Welcome to the Beverly Hills Plastic Surgery Podcast for the 300th time.
Yay! Bells and whistles,
Dr.
noisemakers.
Millicent Rovelo, my faithful co-host, here for the 300th episode. Cheers.
Cheers to that, my friend. Cheers.
There we go. I hope that clang made it onto the mics. But yes, we are
celebrating 300 episodes.
We are all in.
I know. Who'd have thought? Who'd have thought way back when that, 6 years later, we'd still be chugging along here?
I thought you might do 3 with me and then be out of there.
You know, every time I walk in the studio,
it was like,
distinct possibility.
I don't know if this is a good thing, but it's good. 300 episodes is a lot. That's a lot of podcasting.
Yes. And so we started this way back when podcasts were like a little on the horizon. And this was pre-COVID, if that tells you anything. If we divide our lives into eras, this was pre-COVID.
Yeah.
And you already had a podcast because you were doing the Dr. Hockey thing.
Yes.
And so you already sort of had like a little bit of a setup for how podcasts would work. And then you and I worked together. And I had at the time just friends that would ask me questions all the time about plastic surgery things. Like, is this real? Like, is this legit? Does this work? Should I do this? Is this snake oil? And one friend literally told me, she's like, you should have a podcast because people want to hear like actual real information from a plastic surgeon about all these like kind of girly plastic surgery topics. And so you happened to say something about a podcast. I said something about a podcast and we kind of went,
Yeah, I mean, it made sense. And
Yeah.
we were right there and teed off, and it was awesome.
It was awesome.
And
then,
I think we started like in the office though. Like we were like we had like a Zoom machine, and we were like some microphones, and
like
it was
an
pretty
old office, like an office you don't even have anymore. So
Yeah,
that
true.
office is expired, but that's where we started with like 2 turntables and a microphone, just you and I sitting down, speaking into some mics. And then COVID hit and the whole world kind of turned upside down, but we just kept plugging along with our little podcast. And interestingly enough, that's when the whole world turned into podcasts because, everybody was sitting at home. They had a lot of things to say and a lot of time to say it in, and everybody just wanted to say it, and everybody started podcasts.
Well, it is it's a unique platform. Well, not anymore, I guess. It was at the time because, you have to like make it. It's got to be a show. Like on, we're plastic surgeons. We give presentations at meetings. We're able to discuss what we do. We discuss what we do with our patients, how it's going to get done. So it's kind of a natural thing. But I will tell you, all you have to do is turn on some other podcasts, and you're just like, whoa, I can't listen to that. It's just, it's weird. And like, it's really hard sometimes to like understand that this is, it is entertainment at some level. I guess there's information for people here, but you do have to do a show.
It is a show, and it definitely is a time commitment. And we do see the numbers of people that started podcasts in 2020. By 2021, like 80% of them had fallen off because you're not doing it every week, and you're not getting the following, you're not getting anything out of it yourself, then it makes sense to let it fall off. But those numbers came down quickly, especially once people started coming back to work. But we're now still, I think, in a steady uptick of podcasts. And I remember listening to somebody, some comedian or somebody was telling this story joke about how back in the day, like in the 40s, people would sit down around the table after dinner and listen to their programs because you'd have all the programs that would come out on a weekly basis and everyone was so excited to see what was happening. And then TV shows came on, and then cable TV, and now we have streaming. And then we have podcasts, and everybody stays tuned and follows their programs again.
Yeah, well, I mean,
back to our programs.
It's very curated information and entertainment. So it is like, if you want to hear about plastic surgery in Beverly Hills from people that are busy doing it, like this is the place that you go to do that. It's really straightforward. But I like podcasts in general because I can really dial in what I want to listen to, and I'm not at sort of the mercy of whatever the network has programmed for you. And that's why I think they got away from programming as a term and called it content, which I don't really love that term because it sounds sort of like generic, like you're, open up the lid and pour some content in there and that's it. And Will Arnett tees off on that term all the time on their podcast. And I just don't like it. I don't like the term. It sounds too generic. Like it's all content.
Like provider.
Yeah. Oh, okay. All right. So that's how it's gonna be. You want to go down that road.
Push all the buttons
all
today.
right. Yeah, but provider. All right. Yeah. Fine. I can't. I remember the first time that I heard somebody say, "Oh, he's a preferred provider." I was like, "What do you mean?
What does that mean?
Like, what do you mean he's a provider? Like, he's a preferred provider for this insurance company. Like, does he work for the insurance company?
Yes.
What does he provide?
Yeah, what does he do?
What is he providing?" And they're like, "Oh, well, he provides, medical care." I was like, "Oh, you mean he's a doctor?"
Not necessarily.
No, but that was but he was a doctor, as a dermatologist, and the front desk person wasn't ready for my wrath, and
the poor
so I
front
was
desk
like,
person.
yeah, so I lit her up. I was like, provider? Like, really? That's the term? Like, do you know what this provider had to do to become a provider for Cigna? Like, no, wrong. That's not true. That is a doctor, and that doctor is billing the insurance company who has agreed to pay for the care that is provided to the patient. He is not a provider. He's a doctor. Sorry.
That was so good. You just walked and stepped right into that.
Oh.
And so from
Well,
now
yeah,
on,
you
when we
wanted
do
that, I
when
could
we do
tell.
this podcast, I'm going to call you a provider of content.
You said today might be the day that you slap me. However,
It
might go
be
the
the
other
day.
direction here. I mean, I don't know that a cage match was intended with this 300th episode, but it's getting there. I get it.
I get it. Feel free to push any one of my buttons. I'm sure I have a few.
Yes, I'm sure. But the content thing kind of upsets me. But it used to be called programming because of what you said. It was programmed by the networks. The networks decided what you were going to watch. Like, this is what was on. And you didn't have any choice. Like at 8 o'clock, Bonanza is going to be on. You're going to watch, Laverne and Shirley. You're going to watch Friends. You're going to watch whatever. They've already decided, here's what we got for you. Either love it or hate it. Nielsen ratings will tell us whether we rehire these people or not. And that was it. Now it's like they don't want to do anything on any kind of network unless the people that they're putting on there have followers, that they're already a proven commodity. How many followers do they have? Do they have this many followers? Do they have that? Do they have that? It's all about, getting, programs basically or content, quote unquote, that is kind of got a built-in audience and is, pre-curated for the people that want to see, whoever. If they want to see, the influencer Heather Dubrow, for instance, Heather has this many followers. Like, who's going to watch? Well, she has these people. Well, then, Louis Vuitton's interested in advertising on her podcast or her show or whatever, or Real Housewives. And so the change has been pretty dramatic. And so for us, we know that, patients and other doctors listen to this podcast. That's, prospective patients, previous patients, prospective, any kind of prospective patients, and also the docs who are trying to learn, like a lot of residents and medical students, people interested in plastic surgery, a lot of writers for, all these beauty beat magazines. We get a lot of inquiries about what we're talking about from the industry of plastic surgery.
Right, because that's all this podcast was designed to do, was to be a leveling playing field for getting the information out, free of bias. We still don't have any sponsors. So what we're telling you is literally just what we believe and what we practice and what we think. And it's to counteract all the snake charmers out there and the people that are trying to sell you everything under the sun. This is just, the information can't get any more straightforward.
No, we have not had advertisers for specifically that reason. We've looked into that at some points, but the level of bias that introduces, I think, is it's just not necessary for what we do. Like, we produce this podcast, we pay for it to have it happen. So we don't have, somebody, whispering in your ear, oh, and can you do an ad read at, 30, minutes into the podcast or whatever, and ours aren't even 30 minutes. But that concept, to me, it just made it hard to do this. I think if we did like a lifestyle podcast or something like that, or something different, we could consider it. But I think here, I want our opinions to be those of our, medical origin, what we do and how we do it, and not, influenced by, the breast implant company or the laser company or whatever.
Yeah, if we talk about product, like we did a whole Motiva podcast several months ago, it was because we were legitimately excited about the Motiva implants.
Right. We didn't get paid for that.
No, we sure didn't.
But people liked that podcast and they learned a lot and they looked into it. And I know that the Motiva people were pumped about it.
Yeah, I think they were like sending it out to other doctors.
Well, here, listen to what these people say, because we didn't pay them. They said this without it, which is true. I mean, so I do find that, the podcast is a good sounding board for us to kind of, air it out a little bit on what's going on in plastic surgery, especially things like, the Lindsay Lohan non-facelift, the green juice and chia seeds that she, with water that,
I need to
that
get
make
the
her
name
look
of.
so young.
See, I would buy that if she advertised it because
Totally.
she looks great. So I need those chia seeds.
She does, but we've talked a lot about, rhinoplasty techniques, deep plane facelifts, endoscopic facelift techniques, and I just had one of my patients send me a video of the operation that she had done. I did this beautiful facelift for her. She looked great, and she's like, "Oh, I really love it, but could you just make it a little tighter over here?" I said, "Sure, come on back." She wasn't from here; she's from out of the country. And I said, "Well, yeah, you could make it a little tighter." I said, "But you look awesome." She goes, "No, I'm really happy. It looks amazing."
But
I want it tighter. Tight. Can you make it tight?
tight.
I just want it tight. Like Goldmember and Austin Powers. Yeah, so she wanted it tighter. And I said, "Sure, come back." And she said, "Oh, you know what? I found somebody that can do this for me here. And, no offense, but I'm just going to go, run over to this other country and get it done." I was like, Oh, you sure? Oh, I've seen his before and afters. They're amazing. He's so well, thought of. He's friends with people in Beverly Hills that are his buddies, and I have pictures with him having wine on his social media with him. He's so well. He's world renowned. Da 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 da. She goes and has it done. Now she has scars that are on her face, on her forehead, not the endoscopic scar that we talked about. She had some sort of lower lid thing done that has caused her to have now eyelids that are canted inferiorly with ectropion and scleral show. And it didn't, maybe it made her skin a little tighter, which, is fine, but she looks not nice. And
that's so sad.
I just was like, And she said, I think all of the images are photoshopped. And she started going through it. She's like, I don't look like. I go, would you post me on your social media? Like she's like kind of like going back after this guy, and he's obviously is not going to say anything. I mean, unless he's going to Photoshop her, which he might. Who knows? But it's really I think people have to understand it's not. You're not comparing apples to apples a lot of times. It is not just apples and oranges, but it's apples to elephants and apples to, coconuts. And it's really hard in this world to understand who you're asking to operate on you unless you kind of got the insider information.
Is this the time to tell our story that we've been holding off on for years because we thought we weren't allowed to tell it?
No, we can tell it. I actually told this on another podcast. So yeah, you can.
So yes.
Yeah, I mean it's out there, and not only did I tell it on another podcast, but Garth Fisher was on a, and he's a famous, awesome plastic surgeon in Beverly Hills. But he told the story. That's how I was like, I guess it's fair game. But I feel too close to the people because I know the people that are involved in this. So I didn't want to tell the story, but you could certainly tell it because it is a harrowing story.
It is a story. So this story came to you actually several years ago, like kind of direct word of mouth,
2 years ago.
Direct from the people involved. And at the time, we asked if we could talk about the story on the podcast because it was such a buyer beware story, but they were really hesitant about sharing the story, even without their names included. So we, out of respect, obviously held off.
Yeah, I wanted them to come on to the show and tell the story so that people could see that it was real.
It was real. So it never happened. But then as you referenced, Dr. Fisher went on to a podcast and told the exact verbatim story.
It was exactly the same people. It's clearly the same people.
Yeah, the story's out, and so it can be talked about now. Dr. Fisher, of course, being the doctor who was called out by the Kardashians recently for being their plastic surgeon, for doing all of their surgeries. So very legitimate surgeon here in Beverly Hills. So the story goes, there are these three women from the area who wanted to have mommy makeovers. And they kind of looked around the Beverly Hills area and thought these prices are a little bit ridiculous. So let's go somewhere else. There are great plastic surgeons in Turkey, we've been told, and look at their social media, look at their befores and afters, and all their advertising. What could go wrong?
And by the way, there are great plastic surgeons
There
in
are
Turkey.
great plastic surgeons.
They are not allowed to advertise the way that the ones who work with the government are allowed to advertise. So,
Exactly.
So my friends who are amazing plastic surgeons in Turkey are not allowed to be on social media. They can be on it, but they can't advertise their practices.
Right, that's controlled by the government. So if you're seeing a lot of sponsored advertisements coming out of Turkey, it's because those plastic surgeons have agreed to work with the Turkish government. So these three ladies take a girls' trip, go to Turkey to get their mommy makeovers. Surgeries go fine, they do well right
they look good.
afterwards, and they look good, like high fives all around.
And it was cheap.
And it was like, a fraction
It was
of
like,
the price.
like 20% of what it would have cost in Beverly
Right,
Hills.
exactly, 20% of what it would have cost.
A fifth.
So they fly back to Beverly Hills and things are going okay, but one of them starts to feel a little funny. And she ends up somehow getting to the hospital or the emergency room and getting some labs and getting a CT scan of her abdomen.
I think Garth said it was an MRI.
An
So,
MRI.
whatever.
Some kind of imaging study.
Some imaging.
Which prompted a doctor to come to her and say, "How long have you always had just the one kidney?" What? I'm sorry, what? Which then prompted her other two friends to go and get similar studies. And guess what? All of them are missing a kidney.
They're all one kidney
They are
humans.
one kidney humans. So naturally, they call the doctor, the surgeon in Turkey, who they all had surgery with, and he totally owned up to it. He's like,
He
yeah,
says, look,
I did
I
it.
have to do it. It's part of my job here. They would, put a gun to my head. I don't have a choice. It's kind of the deal that I have with the government. And yeah,
I don't know if he said the government. I don't want
I don't know.
target on my head here from the Turkish government.
That's true. We don't know what it was, but basically, like he was forced to do it, quote
He was forced
unquote.
to do it. So he owned up to it. And so that whole story is bonkers and totally crazy. And how this works, if people are at home scratching their heads going, could that even happen? When you're doing the tummy tuck portion of a mommy makeover, you're making an incision through the skin and you get all the way down to the abdominal wall, the rectus muscles, the six-pack muscles. We repair them and bring them back together nice and tight. But for the most part, we are outside of the abdomen. We're working on everything from the muscles.
We are
to
outside of the
We are
abdomen.
outside the abdomen.
Just to be clear.
We do not want to see the inside of the abdomen where there
No,
are
thank you.
intestines and things swirling around. So to get to the kidney, you'd have to open the abdomen, get inside, move all the intestines around, get all the way to the back to find that kidney. Not an easy dissection
not
from
easy.
that approach, and then harvest the kidney. But then the craziest part, it's not that all that just happened, but that there is some black market network in Turkey that can then take that kidney and successfully transplant it into a person. Because to do that, you're not doing that surgery in a back alley. You need a hospital. You need an ICU. You need a doctor. You need a team. You need to have a patient waiting. So, it's such an intricate, elaborate scheme that I guess, if you really need a kidney, to the highest
It's out
bidder
there.
goes the spoils.
It's out there. You can get it. Yeah, I don't know how to do that. That's not something that happens here in the United States.
No.
If it does, it's completely illegal and off the radar screen. But this is something that I was like, we got to have those women on our podcast. I mean, people need to hear that this is you don't know what.
No.
And not to say I'm telling you, my friends in Turkey they're amazing surgeons. They're great at what they do. You just don't know. So if you want a recommendation, happy to give you one.
Yeah.
But I don't, we don't know if you decide Uzbekistan is the place for you to get your plastic surgery. I mean, you can go. I don't know what kind of regulation there is there. I know we all know the stories from Mexico of, people dying under anesthesia, being thrown in the ditch and people can't find their family members till they find them, and it's over. That stuff does happen, for sure. And it's because they don't have any there's no regulation like there is in the United States.
No oversight. There might be a medical board, but it's different. They allow things to slide with less regulation than we do here in the United States.
And if you're cool with that, it's totally fine. But, we aren't cool with it.
No.
That's why we talk about it, because we are under, we just had our Medicare inspection of our surgery center, and everything how many feet does this have to be, and how many medications do you have to have on your crash card, and is everything how often do you have to go through? It is so rigorous to be in practice here in a way that is, super safe and super lawful. Like the operations are hard enough as it is.
Right.
You don't want to go someplace to get this stuff done where you're like, who knows what's happening?
Yeah,
Who are these people?
Do I still have 2 kidneys?
Yeah, well, that should never cross your mind.
Well, so I think
It just shouldn't.
That's where the old adage comes in, right? If it's too good to be true, then it probably is. There is no such thing as a free lunch. Like, that's where you really have to think about, is it worth it to save this money? Because why am I saving this much money?
Message, listen to the Beverly Hills Plastic Surgery podcast. You'll get the information you need. I mean, that's the thing. It is, we were even talking about this morning, like, the hardest thing for patients is, how do I pick a plastic surgeon to do this operation for me? And it's like, do you go by their fancy pants social media? Well, we've already covered that in a bunch of episodes where the fancy pants social media is just that.
Fancy pants.
It's fancy pants. It's not a reflection of actually what's happening in surgery. Yeah. And people love social media, and they love that it looks nice, and they love that the surgeon seems like some big celebrity star, and that they have celebrity patients, and that they're, in with all the big, like, just like my patient said, oh, he's friends with and named people that I know very well who are, big time plastic surgeons in Beverly Hills. That's great.
Yeah. If only plastic surgery worked by proxy and diffusion.
Yeah, it doesn't. It doesn't.
Just because you're friends with a really good one doesn't necessarily mean that you two are
and
good.
a lot of us who are in Beverly Hills, like, we're sort of known commodities throughout the world because we're in Beverly Hills, and we do speak, like, if you're in Beverly Hills, and we've talked about this before, like, you can't stay unless you can pay the bills to be there. And in order to do that, you got to be good, because people don't come if you suck. Right. And they don't pay you if you suck. And they don't ask you to do things for them if you suck. They only come to you and pay that money that it costs to have somebody who practices in Beverly Hills because it's good, because you're going to get good results. That's the truth.
Yeah.
I mean, it is. You and I may not like everybody's results and, whatever, but I can honestly say from a rhinoplasty and facelift standpoint, and even from a breast standpoint, a little less from breast, but from the rhinoplasty and face standpoint, if you're getting a facelift or a rhinoplasty by the people that I know in the triangle,
it's going to be good.
They're good.
Yeah.
I mean, they're good at it.
They're good.
They are.
Choose your style and choose your flavor, but you're going to get a good one.
Guess what, people? Like, there's a reason they're there, and it is true. It's like, you just don't get to stay if you suck. You don't.
Yeah, I think so, and I think that's kind of the motto of this podcast. I hope.
You don't get to stay if you suck.
Or maybe we're just talking into a void. I don't know. But
no, I think people are listening, and I know they are, because they come back and they say, you were right about that. I really need to look closer. I needed to find that, and they. They do. We do get a lot of patients from this podcast. That is because then they say, well, at least they're not going to bullshit me, which is the truth. Yeah. We're not. We're trying to be as transparent as possible about how it goes and what goes down and how it's going to get done. And then if there are problems, because we always talk about that if there are problems, you need somebody that's going to stand up and take care of you.
Absolutely.
Which we do.
Yes.
So I guess everybody should just keep listening. There's more to come. 300th episode. We're happy to be here. We're happy that we did it. There's, I'd like to do 300 more. And that would put us into, that's about
2030.
Yeah, I might be ready to retire. No, I'm not. I think I got a couple extra years. I got to get the kids through all their colleges.
I was going to say, you still have a few more, you have a decade at least, still tuitions.
All right. So maybe episode 900,
yes.
Then I'll be ready to ride off into the sunset or something, or put me, in the Bahamas for, on a permanent basis. But either way, it's been great doing this. It's been amazing to have you as the co-host. It's been great to discuss all the topics. One thing I do want to do in the future, which we're going to tee off right away with, is we're going to have more guests on this podcast.
Yes.
And we're going to dive into some topics that maybe we don't do all the time. Like we haven't talked about hair restoration. There are some things that we need to really kind of, bite off and chew on a little bit to give our listeners, the full picture.
I would love that.
Well, with that said, then more to come. And this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.